Hope you guys are doing well. Hello, Diana. Hi, Rebecca. Hi, folks. I hope you're all doing well for this Tuesday live. Hello, Kanamama. Twixie, hello. Tweens, hello. Judith Glantz, haven't seen you in a bit. Good to see you. Kimberly, nice to see you. The Queen 18, Claudia Martin. Jana, let's see if we're live here. Nope, I am live on both Facebook Live. Hello, Kissy Kissy, good to see you all. It's kind of bright in here. Jesus, Christmas. Let me see if I shut this off here. It's too bright. That's better. Okay. Hello, the cat lady. Hey, Amber. Good to see you. Welcome back on. Bolo Coker. Good to see you. Greetings from London. Good day. I don't know if that's London or not. Oh, I'm having a great week, Amber. Thank you. Rosin, good to see you. Karina Martinez 83. Hello. Oh, there's a journey through IVF. Good to see your name out there. Good to see you. Selene, good to see you. Miss Sanchez. Hi from Canada. Welcome. I'm Dr. Magarelli, CNY Fertility, Colorado, streaming live from Colorado Springs. What's the difference between standard IVF and mini IVF? Okay, so we're going to do questions today. What's the difference between standard IVF and mini IVF? Well, conventional, standard is probably not the word. Conventional IVF is based on your AMH and age. So the drugs can go up and down based on your AMH and eggs. Mini is a flat. It's 200 of Gonal-F, 20 of HCG-LH, 10 of letrozole for 5 days, and 10,000 of HCG. The reason people do mini IVF is because they have low ovarian reserve and they don't want to spend a lot of money unnecessarily on medications. What's your position on breastfeeding during a freeze-all cycle? You should be fine, but remember those, I'm not sure you want all freeze-all. Yeah, I'm not sure you want all those hormones being pumped into your baby. Remember, they can cross into the breast milk, so not really a great idea. I have a mild case of PCOS. What do you prefer? Not sure what the question is. Can anybody take Serovital? Males, females, old, young? Absolutely. Do you recommend any supplements men can take to assist? Absolutely. Download our family building guide. They're all listed there. Folic acid, vitamin C, zinc, a good men's multivitamin. You betcha. Serovital. Can you take Omnitrope for A quality if your AMH is over 1? Absolutely. Anybody can take Omnitrope. It's a growth hormone secretagogue, and if you're over 24 years of age, it's likely going to help. Between mini IVF and conventional, you do conventional for PCOS. Mini is really done for people with low ovarian reserve. PCOS does not have low ovarian reserve. How long till it to trigger? Oh, I went 2 by 2. What is your opinion on MTHFR? Well, it's a gene defect associated with folic acid metabolism, and if you don't manage that, you can have problems with your child, heart, and problems with their spine. So definitely something to take extra folic acid for. Let me jump over here. My daughter has sickle cell disease, and my purpose for IVF is to have a baby without sickle cell. That's that's PGTM. PGTM is, you want to put PGTA and PGTM, Selene. Charmise, hello. Can you take Omnitrope for A quality? I said that already, Charmise. I've answered that. Yes. What is considered a positive serum HCG 14 days after IUI? It depends on the laboratory. Each laboratory has and they just look at the lab. How many units of Omnitrope is recommended? Between 4 and 6 units. Does Botox injections for migraines prevent or affect IVF? Not likely. Good evening. This is Aramex, very polite. Currently 5 days, 2 days pregnant. HCG, first ultrasound, Friday was 20. They want to see me in Albany for another HCG. Anything should I be concerned about? Is there anything I can do to prescribe to boost? No. You never want to boost your HCG. HCG is a function of the pregnancy. You don't boost HCG. That's not something you do when you're pregnant. Is it better to push embryos to a blastocyst? I don't use day 5 anymore, folks. I'm not going to say it. I'm going to say blastocyst, or I'm going to say day 3 cleavage. because a day 5 blastocyst is not right. It's a blastocyst, so it could be on day 5, day 6, or day 7. Is mini IVF better for women with PCOS? No. At baselines for my stims for egg retrieval, my uterine lining was 10. My first monitoring point went down to great to 5 because you bled. That's perfect. Yeah, so no, that's fine. It should have bled and now it's rebuilding. I was doing my medicated FET cycle and I ovulated before 7 days into my cycle. How can this be prevented? Don't, make sure that when you talk to the doctor that you start your ganirelix or your Cetrotide earlier, like 2 days earlier, so day 4. How soon after Hgh testing can I do an egg retrieval? The next month? Does high FSH and AMH of 0.2 automatically mean you will be a low responder? Yes. Elizabeth, there would be significantly less medication. There are breakdowns you can find that show you the incredible amount of meds that you make it to breastfeeding. I know this is because I work. Okay. Elizabeth is answering, well, my DHEA is 325. Is that too high? And if so, what should I do? Well, again, it depends on the lab. That's kind of in the middle. My guess is in your IVF cycle, they could put you on dexamethasone. Kimmy, does high F... Oh, I already answered that. Any success for women under 48 with their own eggs? Under 48? Do you mean over 48? As certainly women who are 18 or under 48. But it really depends on your AMH and the availability of eggs. My lining is 18 and the follicle is only 15 because I was on EE. This isn't ideal for a... I don't understand the initials, sorry. Is the COVID shot required? It's not required for treatment, the COVID shot, but it's highly recommended, and more studies are showing it is the right thing to do if you're trying to get pregnant or are pregnant or breastfeeding, get the vaccine. If you're over 48, the chances of using your own eggs are extraordinarily low. Is acupuncture okay during IVF stim? It is required, not required, it is highly recommended. Does birth control pills help control ovulation? Well, it stops ovulation. I'm waiting to do my transfer after a Pgt testing. Can I take the booster for COVID shot while waiting or not? I'm waiting on transfer after. Yes, absolutely. Yes, but you want to wait a month before you put your embryos in. Can you take Omnitrope and Serovital at the same time? Absolutely. Hello, Alicia. My egg retrieval is tomorrow morning with you, and I wanted to do it fresh. My progesterone came back 2. Why don't you recommend a transfer, Alicia? Because recent studies show almost 0 pregnancies in women who have a progesterone over 1.5, and yours is 2.2. 0. You do not want to do that. I'm 21 and I'm doing the IVF transfer. I'm excited. What's the chance of twins? Can I get more than one fertile embryo put into my uterus? Not at 21. How many acupuncture treatments should you get prior to retrieval? Our studies show 9. I'm going to do one endeavor under my insurance. Great, Amanda. Do as many as you can. Don't worry. 1 is better than none. 2 is better than 1, etc. Thoughts on Pgt testing for people over 40? Unless, Tiffany, you have a reason to do Pgt testing, I don't think it's necessary. What are the survival rates of blastocyst shipping from New York to Colorado? Well, you can ship blasts anywhere in the world. If they're frozen, they don't care if they're shipped. There's no, if they're thawed, then everything dies. It doesn't matter if it's next door, or if it's in the same office. So really, it's not the distance. It's just, and the tanks that we use are good for like 2-3 weeks so of chill. Are there chances for natural medicated cycles the same or lower than IVF at 46 with your own eggs? What? Chance for natural medicated cycle the same or lower, higher than IVF at 46? Oh, I don't know the answer to that. Angelica, I had my retrieval with you. 8 blasts. Holy mackerel. You're so welcome. When can I? 2 weeks. It'll take it 2 to 3 weeks. And what are the chances of euploid at 41? You should get at least 2 euploid, I would guess, in that. After how many failed IUIs do you recommend moving to IVF? Usually 3, sometimes 6. If you're very young, 6. If you're in your mid-30s, 3. Will Lupron help prevent early ovulation from occurring again with that? Was it better? Yes, absolutely. They didn't mention the other 2 that you said. Well, it depends on what kind of a down-regulated cycle you have. All righty. Again, Judith, timed intercourse. Okay, timed intercourse. I'm lost. So timed intercourse. Oops, I'm losing everything here. My lining is 18. Follicles only 15 because I was taking. Okay. Yeah, I don't. For timed intercourse, lining is 18 and follicles only 15. That seems very thick for me. I would rather you have a bleed and start over. I had an ectopic pregnancy in 2019 and I've been trying to conceive, would like to do an IVF, and I want to know the procedure. I'm 32. Look up our family building guide. You can get it at CNYfertility.com. Are ganirelix and citrotide interchangeable? Absolutely. What's the process for Hgh? You isolate a sperm, and one at a time you inject the egg. That's what it is. I don't have any opinion on pregmune. I don't have an opinion on that. Caitlin, I'm 41. AMH is 0.08. What Hgh do you recommend? 6 units. And prime with estrays and 6 units. And then you need to be on Mthfr. Miscarriage of PGS tested embryos. Why? Because it's only 70% accurate in predicting a normal, but 90% accurate in predicting an abnormal. So just because it says it's normal does not mean it's gene normal. It means it's chromosome normal. Hgh and Clobid in men, do you see results? Yes. Hello, Lashandre Anderson. Thank you. I can't wait to meet you. Mama Black Queen, it says, I have a low positive for a pregnancy test and I test again tomorrow. What keeps causing my low positive? This happens a lot. I am 43. Well, typically it's because of chromosomally abnormal embryos. They start to develop and then they stop, unfortunately. Should we check for natural killer cells and cytokines after multiple miscarriages? Some people do. I'm not a big fan of that because I don't think there's enough data, but some people do. I'm 37. This is Vicky, and have 2 frozen 3-day embryos. Any chance of these being successful? Absolutely. Doctor didn't put me on Levodopa. Should I ask for it? 39-year-olds, no health issues? Not necessarily, Mary. If you've had no recurrent pregnancy losses, you don't necessarily need to be on it. Thoughts on TQ alpha treatment? Dairy Queen treatment? Don't know a thing about it, Maggie. I just don't know what DQ alpha treatment is. Sorry. Let's see. Fresh transfer or versus frozen is more and more successful. Absolutely, Jason. It depends on the patient and the circumstances. Should I be worried if I got a positive ovulation on day 27 of my cycle? Not at all. Question, does PRP lead to IVF success? In a single study or maybe 2 small studies that suggest it might. Wow. I was debating on should I do mini or standard IVF. I'm new to this. Lashandre, how old are you, Lashandre? Get back to me. Usually it's for women over 40. Rosin, I'm 42, cycle day 3, showed leading follicle 13 plus 2 small follicles. Estrogen is 68, was put on estrogen, cycle day 21 for 70 to avoid leading follicles. It's okay, it's wonderful. What do you think about intralipids to prevent further miscarriages, Mama BG? Well, I don't think there's data for that. I think there's data for reduced inflammation. I don't think it can hurt. Can I do mini IVF if doing gender selection? I would strongly advise against that, because to find the gender you want needs lots and lots of eggs, and mini means small, means less, means fewer. So no. Can you do Pgt testing on embryo that has already been frozen? Absolutely. Friday, I had 10 nice sized follicles. I triggered Saturday night and Sunday morning. Egg retrieval was Monday in Colorado, and no eggs or follicles per Dr. Fink. Did I ovulate early? He suggested duostim. Well, Crystal, my guess is that you have very low ovarian reserve, and there's probably an age component to it. So the suggestion that I presented here, I think a couple of weeks ago, is that duostim is really good for those. By the way, duostim means trying to get 2 retrievals in 30 days. Amanda, I answered that question. Hgh and Clobid in males, does it work? The answer is yes. I did answer that, Amanda. La Negra, I'm 44. Any chance with my own eggs? Yes. Get an AMH, get some testing, and get started early. What meds are used for mini IVF? They're Gonal-F, HCG-LH, letrozole, and trigger. That's it. There's no Mini just means less. It's still IVF. It's just less medicine. Is there evidence that day 5 embryos are better than day 6? Yes. But again, it's blastocysts, not the day of the month. Jasmine McGuffin, the amazing Dr. Mags. What is that? Ashley, would it be beneficial to do Zymod for low morphology for my next retrieval? No. Zymod is just simply a procedure to separate sperm, and Ichtsy can do that on its own. Dr. Kills prescribed 10,000 units of Hgh. We have a 5,000 container left. Can we use the 5,000? It depends on what it's for, Amanda. Again, if it's for a trigger, 5,000 can be a trigger, but find out why he recommended 10. Sorry. Recurrent pleasure implantation failure with PGS tested embryos. All uterine studies are normal. Why? Well, do a endometrial receptivity assay. Find out whether the timing is right. Do acupuncture. When's the last time you had hysteroscopy? Look inside the uterus to make sure that there's nothing going on in there. Serovital, growth hormone, avoiding alcohol, tobacco, drugs, even in your partner. Smoking will cause you to not get pregnant even if your partner is doing it, or to reduce your chance for an ongoing pregnancy or miscarriage. Sarah, timed intercourse 37 years is equivalent, and with low MH going okay. It's certainly okay, but your chances are less than 5% per try, which is, if that's okay with you, that's okay with us. All done. What is Maggie? What does all done mean? Okay. What does that mean, Maggie? Oh, you did all of those studies. Then you might want to look at gestational carrier. Can you retrieve with less than 4 mature follicles? Absolutely. Do you need to remove proximal block fallopian tubes during IVF? Absolutely not. Can males with 0 morphology still produce a pregnancy? Absolutely. I just had my retrieval today. 40 eggs. Oh my God. Okay. Rosin, repeat your question with your age because he won't remember. Yeah. Yes. I would love to hear about the progress in the field of creating sperm eggs from other cells in the body. Would love to talk about that. I will consider that. It's for male factor infertility, 3 mil every other day. Okay. That's Amanda. Okay. Ascana, I wasn't sure. Oh, no. Yes, Amanda, you can use that bottle. Yes, you can use the 5,000. You can use the 10,000. No worries. Good evening, Dr. Magro. I hope you're having a great day. I am, Caitlin. Ashley, is a 7% motility bad? Well, for intercourse, it just means it's harder for intercourse to work. Christine Gray, can a block tube cause miscarriage? Nope. Only a fluid-filled tube will increase your chance for miscarriage. Testing positive after my transfer last Monday. Everybody congratulate Alice, boys. Keep going, girl. How do I prevent ovarian hyperstimulation? Acupuncture, high-protein diets, and be very cautious and make sure you tell the nurses, hey, I'm at risk for high ovarian hyperstimulation. And so they will help you by saying, hey, watch my estrogen, watch my estrogen. What days do you do your frozen embryo transfer? It's on the 6th day after you start your progesterone. How will I know if a tube is leaking? Well, you have to have a hydrosalpinx. You have to have a centimeter on an ultrasound, not with an HSG, of fluid. And if that fluid is there, then you can assume. C. Martiza is coming in Monday. Yay. Can a subserosal fibroid with no mass affect implantation? No. When do you recommend Duostim, Andrelina? Well, I recommend it when there's over 40 with extremely low ovarian reserve. What are my views on DHEA in terms of what? There are studies suggesting it helps. There are studies suggesting it doesn't help. There are studies that say that it's useful in gals less than 35. There are studies saying it's useful in gals over 40. There are some studies that say it's not clear, statistically irrelevant. I think that going back to Kaysen's original study, I think there's something about it. When doing an FET, will we be able to control your progesterone so it doesn't go over 1.5? No. Alicia, in a frozen embryo transfer, that's never the question. Only in a fresh embryo transfer, retrieval is the issue over 1.5. How does day 3 frozen transfer work? Do they take it out and let it thaw and then transfer on day 4? No. They transfer it on day 3. It only takes a second. If it's frozen, they just thaw it that morning and we put it in. Jennifer, I haven't done my preconception testing within a year. Had my consultant was told to call on Cycle Wednesday schedule saline and baseline. Does that mean I have to wait another month after baseline to start because I didn't receive med list? Hard for me to understand that. Talk to your nurse. I'm 42 years old. New protocol is going to have 400 Mthfr 150. Is this too much? No. Do I still have a chance with an IVF with a high FSH and low AMH? Many people do. Low AMH, that put me on metformin. Is this too much? That's the standard dose for metformin. Does ubiquinol and N-acetylcysteine help outcomes? It's suggested, but it's certainly not proven. Do I recommend Omnitrope for IVF? Absolutely. Let's see. Okay, Jasmine, have you ever treated any patients that have a history of borderline tumor of the fallopian tube? No, I actually haven't. But I haven't. That's a great question. Talk to the oncologist. I mean, we can treat you for sure, but I have never. Can Canadians get medical insurance to cover IVF in the United States? I have no idea. I have call the I have no idea. My TSH was 2.49. Should I up my levo? I've been on 25 milligrams. Yeah, talk to your doc, but I would say that you want to have your TSH 2 or below. I'm curious on when to go for egg retrieval during stims. Well, I don't. It's when you're ready. It's usually after 11 days of stimulation. Lashandre, I'm 30 years old, so would you recommend mini IVF? Nope, standard. Standard. The only time to do mini is when you have very low ovarian reserve. Elizabeth, oh my God. We were grant winners, just entered third trimester. Never give up. Listen to Elizabeth. Never give up. Fantastic. Oh, Maria, yes, it's true. Even Americans can't get insurance. Jasmine, my serious borderline tumor on my tube was the size of a football. I start my IVF next week, and I think you are my scheduled doctor. So your question was what? I don't know what your question was. Your tumor has nothing to do with the retrieval as long as it's been removed. Is it okay to transfer 2 day 6 blast grade? And by the way, you should talk to your cancer doctor about whether or not you can do IVF, not your reproductive doctor. Let's see. Is it okay to transfer 2 day 6 blast grade together, 36 with a low AMH? If you've had a failure before, I don't see a problem. Eleanor, after IUI, I have 4 progesterone. Is that too low? Yes. So get some supplement. Severe PCOS, was told to do mini to prevent making too many eggs. Yes, that will prevent you from making too many. It will lower your chances. Does sperm affect sperm? Does caffeine affect sperm quality? No. Maria Schwartz, why not? Don't know who that is. How soon after birth can we do another transfer? Usually 18 months, right? Because you're breastfeeding and raising the kid. 6 months if you're not breastfeeding, that kind of thing. So since my last transfer failed, could I transfer 2 next month, Ashley? You'd have to talk to your doctor. That's the doctor's prerogative. And if I'm your doctor, you have to talk to me. Okay, thanks. I got my tubes reversed last year. Would that affect IVF? Lysandra? Yeah, a little bit, but not much. You can do it. I don't know when the grants are being announced. 18-year-old with Crohn's disease, tubes were tied. What protocol would you recommend? Well, the young age is what determines in your AMH. So get your AMH, but a low dose protocol would be good, not a mini, a low dose protocol. Can high dose progesterone help with implantation? Yes. How many rounds of IUI before doing IVF? 3. How successful is sperm aspiration in a male after a vasectomy? 97%, 99%. Can you start the cycle while you have a cyst? You probably don't want to do that, Eleanor. Can you do duostim with a mini IVF? It's kind of, I don't know the answer to that. I don't see why you couldn't, but I'm not quite sure it's a good idea. I've heard PCOS usually have a high AMH. I am 35 and have PCOS, and I've been on metformin for 2 years, but my AMH is... So, Amanda, PCOS has high FSH, when they have eggs. But if they're running out of eggs for whatever reason, like Hashimoto's disease or something, that's where the low AMH comes in. Are transfer rates okay for someone who had a gallbladder removed a month before an embryo transfer? Well, it's usually 4 to 6 weeks of recovery. Again, that's a surgery. 2 menstrual cycles, I think, is safe. Oh, boy, everything. Elizabeth. Oh, so many reasons. I'm happy to explain in detail, but it's very likely that it would not be worth it even if you had to get insurance in the U.S. that had some fertility. Oh, so Elizabeth, I think you're answering the insurance question. Well, at CNY, our prices are lower than most people's co-insurance pays, so you might want to just look at our pricing. I think I've answered this a dozen times. The difference between mini and a low protocol is mini has letrozole. A low just means low. It doesn't mean anything. All right. Is low AMH, would an IVF be the best option depending on how old you are? Is 3 weeks after hysteroscopy too soon to transfer? I think you're right on the border. Let's see. But nurse, she told me it's okay. I started and I had successful cycle, unfortunately. Unsuccessful. Eleanor. I can't follow through all of these things. Husband lost all his sperm between 2017 and now. What would something like this happen? Why would something like this happen? That's called usually spermatogenic arrest, or it could be an obstruction. She needs to see a urologist. How many follicles should there be in each ovary on day 3? It depends on your age and your AMH. How to prevent OHSS? You want a very low, slow protocol, which means your gonal for your gonadotropins that are about 200 units. That's one way. Acupuncture is very helpful. High protein diets. Is it okay to continue omnitrope while waiting to do an ERA, then a transfer? Absolutely, Angelica. Canadians have a group on Facebook, Come to Canadians Going to CNY. There you go. I'm wondering if I should do fresh or frozen. AMH is 0.3 fresh transfer, Myra. If you're over 40 and you have a low AMH, do a fresh transfer. Do you have an andrologist at the clinic? Yes, but not a urologist, but an andrologist. In our country, that's just a person who does the andrology work. But if you need ICSI or anything like that, we do have a person in town we work with. Is acupuncture helpful for low AMH and high FSH? Absolutely. That was our original studies back in the year 2000, was specifically on patients with low AMH and high FSH. Dr. Credenda from East Winds Acupuncture and I created the Credenda Magarelli Acupuncture Protocol. Is used around the world, and we have over 1,000 folks who have been trained by us as acupuncturists. FSH is 12, AMH is 1.4. Are these bad? No. Have a consult with CNY on the 14th, wondering about a mini. 35 years of age. I would do a conventional dose. Again, Lysandre, I've answered this a few times. What is the difference between fresh versus frozen? It's a fresh transfer is you do a stimulation, you take the eggs out, you put the embryos in. A frozen is you're frozen and you put the embryos in. What high dose protocol impact negatively egg quality? No. The data says no. Can you explain fibroids? Well, they're a muscle that grows inside a woman's uterus. I was shocked no one mentioned it. It was 2 centimeters. Does this need to be taken care of? As long as it's not pushing into your uterus and you have a normal HSS, you do not have to worry about it. What can I take for this all-day sickness? I feel terrible. I don't know. How soon do you do acupuncture to improve? Well, you need to start acupuncture as soon as possible. What is the success rate with fresh versus frozen? It depends on many, many different things. Should I do fresh versus frozen? My only issue is my tubes. Doesn't matter. It's if you're older than 40, do fresh. If you're in your 20s, you can do fresh or frozen. If you have PCOS, do frozen. If you have ovarian hyperstimulation, do frozen. It's not whether you do fresh or frozen that determines success. Will you elaborate why your progesterone has to be 1.5 during fresh but not FET? Just kind of confused. Okay, no. You do not want your progesterone at all elevated in a fresh cycle because it starts implantation window processes. And therefore, if it's above 1.5 at the time of retrieval of the eggs, that means your implantation window will be closed by the time the embryo is ready to implant. In a frozen embryo transfer, you can't, you actually time the progesterone so that it's exactly, which is 6 days, where it needs to be. So it's not the level. It just so happens if the progesterone is above 1.5, then unfortunately you're run the risk of a not getting implantation because the timing is off. Anna, my first appointment with CNY isn't until May, earliest available. I want to do IVF. I've had 3 failed. Is there anything I should do to prime before my appointment? Yes. Download the family building guide, start acupuncture, Vital, avoid alcohol, tobacco, drugs, you and your partner. Should we allow the doctor to determine if fresh or frozen transfers is best for us as a patient? Absolutely. Do progesterone supplements raise body temperature? Absolutely. That's progesterone. That's not pregnancy. Here we go. Lisa, what does it say? FSH 9, AMH 1.8, 43. Yeah, that is a good number, Tiffany. Should we go ahead with stim and retrieval with polyps? Yes, because you want to make eggs and embryos first, store them, okay, and then later on, once you have time, then your uterus, you can fix the uterus later. How many days do you normally stim before an egg retrieval? 11. Should I supplement extra progesterone if only 12 at cycle day 23? No, not necessarily. Do you recommend genetic testing of the embryos? In selected cases. Thoughts on transferring mosaics, low levels? Please, yes, do them. 23-year-old AMH 1.6, is that on the lower side? Yes, but again, youth trumps AMH, Jasmine. So the younger you are, it doesn't matter. 1 egg, 1 embryo, 1 baby. Okay, remember that. Is it you? What are we doing, Megan? Righty, should I supplement? We've already talked about that. Okay, is it uncommon for IUI to work the first time? It is extraordinarily uncommon for IUI to work on the first time. Could high progesterone cause chemical miscarriages? Nope. My periods are 5 days later than normal. I hope it's not a sign of perimenopause. I don't know the question. Irregular periods can be the perimenopause, depending on how old you are. What to do about big cysts keeping you from starting stimulation? Go to surgery. Does IVF usually provide more boys or girls? Bird bash, not sure. Probably even. Rosin, I was diagnosed with epiploic appendicitis, inflammation of the Does it affect IVF? Not that I can think of, Rosin. What are the signs of perimenopause? Not in this discussion. We're fertility oriented. Irregular periods, missed periods. You can even get the onset of early hot flashes and flushes. If coming from out of state for treatment and looking for monitoring there, how long should I plan on staying? About 17 days if you're going to do, Nikki, a fresh transfer. Oh, my God. This question about fresh versus frozen transfer. Guys, it has nothing to do with age. Well, if you have very low ovarian reserve, I recommend fresh. I do recommend fresh with very low ovarian reserve. If you have high ovarian reserve and too high estrogen, then again, frozen may be beneficial. We have a whole bunch of discussions on fresh versus frozen on our website. Oh my gosh, Nikki, my pleasure. What day of the cycle do you start stim meds? Usually on the 2nd or 3rd day of the cycle. If you have a hydrosalpinx and had my tubes removed, what would be the success rate for a mini IVFB? I have no health issues. Well, if I have to find out if your tubes are blocked, Leela, if your tubes are blocked, then you're good to go. If your tubes are not blocked and that hydrosalpinx is there, then you have to get that removed. I'm in a low dose protocol. Do you recommend using Mthfr? Yes. What happens in the case we have irregular periods? How can we start a cycle? Doesn't matter. We just check that your estrogen and progesterone are low, or we can start a cycle for you. So don't worry about that. What causes blockage of tubes? Sexually transmitted diseases, appendicitis, inflammatory bowel disease, any kind of infection, trauma, surgery. Yeah. Those are lots of reasons. Opinion on sperm fragmentation testing after multiple miscarriages. My opinion. Yeah, I don't know. I think there is some sense to that. If the male has severe oligostentoteratospermia and DNA issue, yeah, there may be some. Yeah, you may want to. But there's a lot more to the story. Talk to your doc. All righty. Tiffany, I like priming with growth hormone. I think the studies are stronger. There's not really many studies or any studies with serum vitals. So I would, if you're thinking about priming, you could prime with growth hormone. You don't have to have a period to start IVF. Can an ectopic affect IVF? Sure. What happens if your 11th day of stimming falls on a Sunday? Well, remember, that's your trigger day. And then you have 2 more days before the eggs come out. And plus, we're very good at timing things. We could always add or subtract a day. The body's very good. California baby, Abby, hi, Dr. Mag. You did my transfer last month. I'm pregnant. Heartbeat today. God bless you. Who is that? So we can all congratulate you. That's California B. Just be Kimmy. My consultation is later this month. How quickly are you able to start? About 4 to 6 weeks after you get your consultation, you should be ready to start. Oh, Chloe's baby journey. Oh, thank you. Ultrasound on the 11th. Oh my God, another pregnancy. I'm loving this. What happens? Okay. How long after starting Synthroid should you check at TSH levels? 4 to 6 weeks later. Everybody's giving you some congratulations, all you wonderful pregnant ladies. What supplements do you recommend before retrieval? We'll download our family building guide. You can find it at the CNYfertility.com resource page, and it's free. Oh, kisses. I love kisses. Lyssandra's congratulating you. Yay, Holly's congratulating. All these wonderful people. Team spirit for everybody. This is great. God, this is a lot of fun. Do you have embryo adoption at your clinic? Yes. All right. Oh, my voice. Woo-hoo. Talking too fast. All righty. I'm turned 45, planning to do 1 retrieval with 1 capital and adding a donor egg and freezing them since we would like to use a surrogate possibly in the future. Own egg embryos at 45, less than a 5% chance it'll work. Or should I go straight to donor? Yes. Husband wants to give own eggs a try, then do that. Oh, wow. I did not know this. IVIG costs $3,000 and it isn't covered by insurance. Holy mackerel. I did not know that. I don't order IVIG. Do they do retrievals in Buffalo now? Yes, but I don't know how many. What specific labs should be requested to test for Hashimoto's? TSH, free T4, T3, and the anti-thyroid antibodies, antimicrosomal antibodies. Tried gummies. Don't know. Tried gummies. Have you tried gummies? I don't know what that is. Any outside monitoring in Southern California? Oh my God, yes. Yes. So talk to the global travel group. You betcha. I guess you guys are answering questions for each other. I love that. Oh, okay. Here's one. I am 48, never been able to have a baby, was diagnosed with PCOS, had surgery to remove a cyst. August of 2020, have had 2 miscarriages this year. What else can we do? Well, you probably need to do IVF with pre-implantation genetic testing. So IVF with PGTA is a good place to start, and also get a recurrent pregnancy loss workup. Okay. How many IUI treatments do you recommend of moving to? Gosh, I thought I've answered this like 3 times. How many IVI? So if you're If you're less than 35, you can do up to 6 IUIs. If you're over 35, do 3. Does an egg donor need to be your blood type? No. Who needs to prime? People who have very, very low ovarian reserve. If your AMH is 14, you do not need to prime. You do not need to prime. How long do we have to ship sperm out to the clinic before start of IVF? It has to be in the clinic 2 weeks before. And that's only for your safety because you want to make sure there's sperm there when your eggs come out. Can morphology be improved, Sylvania? Not from the Western perspective. In Western medicine, no, that's more genetically determined. There are some traditional Chinese medicine studies that suggest they can do it, but I don't know anything about those. Cramping after transfer normal, you might be dehydrated. Make sure you're resting. How do you define very low AMH? Below 1? Kirsten Hacker, age 31, AMH 0.1, 50 days, no period. My FSH is 38. Bleeding finally started on its own day 2. Does this mean donor eggs? Yes. Does shipping sperm affect the quality of sperm? No. Unless it thaws, of course. I've been differing options, but after FET, do you recommend normal light activity versus bed rest? I just want you to rest for 1 day, then regular activity. Can sensitization from a previous miscarriage in an Rh-negative woman cause a first trimester miscarriage? I think the answer is yes. Can you transfer more than one, or is it up to the doctor? You really shouldn't want to transfer more than one, and I'm going to do a whole talk, I think, in a couple of weeks. There's some horrible data on twins, triplets, quadruplets. In other words, there are long-term things that happen to these kids and families. So you really want to do 1 egg, 1 embryo, one transfer, 1 baby. You're welcome. And yes, you have to talk to your doctor about it, but it's the American Society for Reproductive Medicine, for really good reasons, recommends 1. So, Nikki, you're doing all the good things with carnivore and keto and intermittent fasting. It's not going to change your egg score if that's what you're asking. How long does trigger shot stay in system at the frozen transfer modified natural trigger shot? I think the half-life is 3 days. Do you need to do Zymot if semen is normal? No, you do not need to do Zymot. How does stress affect implantation? It's so stressful having already doing acupuncture. Well, stress affects your cortisol levels. They think that's one aspect of it. Blood flow is another aspect of it. So there's many, many different ways. Excuse me. Does bleeding affect retrieval? I want to retrieve because of a thick lining due to estradiol. Can I do, or bleeding has negative effect on? No, bleeding has no effect on egg quality, Judith. Okay. Where are we at here, folks? Good. So this is Dr. Magarelli. I'm at CNY Fertility, Colorado. Bird bash. What is a normal amount of days you should have between menstrual cycles? 28. Does that give you a better chance at IVF? It can. It just means that you have eggs. Does immune protocol apply to Edelwin, or do you do it for both retrieval and transfer? Though the immune protocol is a combination of approaches that was designed by CNY. It's a name. Again, these are just names for different medications that have been associated with higher outcomes but not proven. So these are add-ons, these are additions, these are hopeful things. These are the icing on the cake that we provide patients who want them, but you do not require them. You do not require them. I'm awesome. Thank you, Christian. Or maybe it's somebody else who's awesome. Can motility improve? What do you recommend? Avoiding alcohol. This is love counts. Alcohol, tobacco, drugs. Take your Serovital. Take a good vitamin. Go to the keto diet. Lose weight. Those are great things to help male sperm. Can I do my FET in the next cycle after my egg retrieval? Absolutely. Is 33 days still a normal menstrual cycle? It's on the edge. How can CBD oil help fertility? I have no idea. I don't think there's any studies. I'm probably going to set up a consult with you all. Our third IUI is a fail. I'm so sorry. Tips for recurrent pregnancy loss. Have tried aspirin, Lovenox, Plaquenil, and intralipids. Find out if there's something going on inside the uterus. Do acupuncture, Serovital, growth hormone. and then think about possibly a gestational carrier. And again, I don't know enough about your history. Can low cortisol affect the implantation as well? Not likely, Erica. You're welcome, love. Okay, we said that. Have you worked with a male who has experienced testicular torsion? Absolutely, Jumbo Brittany. Excuse me for just a second, guys. I just have to check this here. Alrighty, I apologize. There's a call, something going on here. Just 1 second. Sorry, I'll be right with you guys. Just hang on a second. I apologize. It's a patient thing here. Sorry. Oh. Again, I apologize. Okay. Alrighty. I again apologize, guys. Okay, back. Sorry. My partner has a hydrocell. Should I be worried? Well, it certainly it's painful, and it can affect sperm. Any tips for implantation after FET? Yes. Acupuncture, serovital, low carb. Would you recommend Zymot for delayed liquefaction? No. Some women swear by Mucinex. Could it actually help women conceive? Some people say that. I don't understand. I can understand mucus issues, but that may be for intercourse. I'm not sure it's for IVF. But again, I've not seen the studies about that. Can IUI be successful with 3 small follicles? No, you have to have a certain. Let's see. What was the question? Well, you have to have a certain mature follicle for IUI to work. Serovital whiskey cookie is a growth hormone secretagogue. It's a vitamin that you can pick up. You can pick up at Costco. You can pick it up online. And I take it because as you get older, your growth hormone goes down. This causes your growth hormone to go up. So there you have it. Would you recommend? Okay. Any advice on conventional IVF versus mini versus natural for patients with a history of endometriosis? If you're less than 35, it's conventional. If you're over 40, you might consider a mini. And then in the middle, you should have a discussion. I have a submucosal fibroid, also 1%. Okay. Okay, I don't know. Audacity to hope. I don't know what that means. Thoughts on Chinese herbs with acupuncture, Maggie? Absolutely. If you're going to an American Board of Oriental Reproductive Medicine doc, absolutely. If you're going to the Healing Arts Center, absolutely. Otherwise, be cautious about making sure that your acupuncturist understands IVF. Laparoscopic hysteroscopy scheduled for February. How soon can I transfer after the procedure? 4 to 6 weeks. Will metformin help with IUI? My doctor recommends I take metformin is a pill. It's not a shot. So maybe you're a little confused. Wheels go round and round. So if the reason for the adding the metformin is to help you ovulate and take control of your PCOS, then yes, that's certainly something that you can do. All righty. Everybody was quiet now. Sorry, I know I had to get on that call. Would Serovital help me to recover from my gallbladder surgery faster? I think it may, because growth hormone is necessary for getting you back to youth, right? Open myomectomy is scheduled for me. How soon can I do transfer? 6 to 8 weeks, probably, Rosin. Is having a period that's 2 to 3 days long problematic? No, that's absolutely perfect. Good job. Absolutely perfect. You're welcome, Hannah. Why do you recommend lap hysteroscopy for cases of cysts and or fibroids? because you asked me. In other words, if you have a persistent cyst and it's interfering with your chance for IVF, how else would you fix it? You want it to go away, and if it doesn't go away on its own, then you absolutely want to do something about it. How would you recommend someone accurately track their ovulation? I actually don't know. I think there's ovulation predicting kits. How do you find out which insurance your clinic covers? You call a financial team. 6 to 8 weeks after transfer, after a myomectomy, you can do a transfer, weeks. And an egg retrieval tomorrow, why is it recommended to have no smelly clothes? Because your eggs don't have a liver, your eggs don't have a kidney, your eggs don't have lungs, your eggs don't have skin, the embryos don't have anything to detoxify. And believe it or not, if you can smell something, the embryo considers it toxic. So avoid any kind of perfumes, any kind of smelling, nail polish. We spend $500,000 just to put special air in our retrieval wombs just to get rid of anything that could be toxic to the egg or embryo. What size of follicle is ideal for IUI? Something between 18 and 25. My last SG was April. Is it worth repeating it to rule out a hydrosalpinx again? No, a hydrosalpinx is something you look at on ultrasound when you're not doing an HSG. When you're not doing an HSG. Does your clinic remove a tube with hydro? We tend to clip the tube. Can one have egg retrieval before your tube is removed? Absolutely. And does this delay the process? Of course it does. Because everything takes time. Everything takes time. Okay, let's see. All righty. We're getting slow down here, folks. What kind of questions, or am I missing some? Oh, there they are. Sorry. 3 failed FETs, hormone level always appropriate. Any blood work or factors should be considered. Well, you should do an endometrial receptivity assay, an ERA, acupuncture. You should do hysteroscopy, not just HSG. You can do receptiva to see if you have endometriosis. Can you see a hydrosalpinx on a saline sonogram? Yes, but it's not the right time. Wheels go round. Thank you. Thank you. How does bada bing? What does bada bing mean? It's an expression. It's an Italian expression. It's like I'm going to punch you out. Bada bing, bada boom. That's just, I don't know. It's an Italian expression. Andrelina, you're very welcome. What extra tests do you recommend for someone with unexplained? Most times, unexplained just simply means it's an egg or a sperm issue, kind of likely, or an age issue. So I don't get too wiggly about unexplained because typically, if you do some more studies, so a good semen analysis, you might do an AMH, definitely hysterosalpingogram, hysteroscopy, hormones, thyroids, prolactin. If somebody's a smoker, if somebody's a heavy drinker, drug user, of course, that's all going to do it. Will you allow a 45-year-old patient to try to use their own eggs? Yeah, of course we will. If you weren't a fertility doctor, what would your specialty be in medicine? Psychiatry, probably. Let me see. I'm not a fertility doctor. An acupuncturist. I was in the waiting room last week when you stepped out just to say hello. That meant a lot. Very excited to be your patient. Alicia, it's my pleasure. I love you guys. I'm so happy to see you in the clinic, and I really enjoy, the being able to help. I mean, this is what I love. Okay, Rosin, I have untested frozen embryos, and can I transfer one at a time to avoid? Yes, please, Rosin, one at a time. Hillary, I'm doing a 3rd IUI this week. My doctor wants to do 3 more cycles with added medications. Should I do more or move on to IVF? I'll be 41. Move on to IVF. Move on to IVF. Move on to IVF. Move on to IVF. You're losing 10,000 eggs every month, Hillary. Move on to IVF. Move on to IVF, please. Do you recommend amitrope for FET? Yes, sometimes I do. I'm already taking Serovital. Yes, Johanna. Layla, all my tests came back normal, but my tubes are blocked. IVF. Conventional IVF. Can you take LDN until all the way to retrieval if you are only under a local anesthetic? Yeah, the low dose naltrexone, guys, is just, it's, gosh, how do I say this? It's just, yeah, one of these days I'll do a whole talk on it. I'm still trying to figure out. Oh, you're so welcome, Bird Bash. My pleasure. Lindsay, almost 42, AMH.2, looking to do IVF since timed intercourse on IUI ended in chemical pregnancy. Had hysteroscopy, laparoscopy. How many cycles should I expect to go through before possible success? 3 to 4, absolutely, Lindsay, and do it yesterday. Don't do IUIs. If you're over 35, sex and IUIs are the same. Over 35, sex and IUIs are the same in terms of fertility outcomes, so go on vacation. What causes a chemical pregnancy? Usually it's a malformed embryo, so in other words, not normal. And we all get them. You may not be able to answer this, but do you have a good number of eggs that can be expected at retrieval for 35 with an AMH low? Yes, 4 to 6. Will having 3 myomectomies affect the outcome of my IVF? Not if you need them. It's only going to be positive. Do you find having Hashimoto's more difficult to get pregnant? Yes, because they have lower ovarian reserves. Hi, Big Bay from North California. Oh, guys, I'm losing my voice again. Okay. Well, I think what I'm going to do is I'm going to sort of sign out here. I'll take a couple more. Thoughts on birth control pill to time a cycle? Absolutely positive. What could cause a chemical with a PGT normal embryo? It may not be 100% normal because PGT is not 100%. Recommendations for someone who had laparoscopy, cyst removal, and stage 4 endo, starting egg freezing. Yes. Acupuncture, Serovital, all the vitamins we recommend. Well, anyway, guys, I'm going to sign off. I've got a meeting with all my docs actually in another 15 minutes, and we're all going to talk about you guys. Only kidding. Anyway, I'm not sure what I'm going to talk about next week. Thank you so much for joining me. And think pregnant thoughts. Remember, the world and nature wants you pregnant. You don't have to fight to be pregnant. Your body wants to be pregnant, and we're just here to help. And just keep the faith. Work hard. Please say positive things if you can on the various media. Sometimes people cannot be so nice. And if you do like us, and if you don't like us, or you feel like we're not doing something, please talk to me. I would love to know because we'll fix it. Anyway, thank you guys. Love the kisses. I know you guys. I know I love the kisses. So take care, guys. Bye-bye.